Christy Gupton. I'm an employee benefits advisor, and my company is called Custom Benefits Solutions. And I'll tell you more about that as we go along. But as an employee benefits advisor, I knew that healthcare is broken for the most part, except for the people who designed it this way. So this is a webinar about Sedera, medical cost sharing, and I'm bringing this information to you both as a member of the Sedera community and as a professional, as an employee benefits advisor, how I decided to make that change in my own life and come over to a plan that I felt provided me with transparency and with access to the best care, literally 24/7. So we're going to talk all about that. I'm going to share with you what makes medical cost sharing unique, how it's different from insurance, and a little logistics about how it works. So starting out, it's important to understand that with Sedera, every member is a cash pay patient. So that concerned me at first until I realized that cash prices for healthcare services are a lot lower than what insurance companies negotiate. And once I figured that out, I thought, well, why do I need insurance if the cash price is lower? And if healthcare providers are willing to give me a cash discount, what good is insurance? So I started to go through those thought processes, and it was easy to make this decision once I was comfortable, understanding that cash really is king. So at Sedera, needs are shared with the community on a per need basis. And we're going to talk kind of all about these things that you see on the screen. Even I have really become a better, more savvy healthcare consumer as a part of, being a member of the Sedera community. It encourages me to really look for the best quality at the lowest price. And Sedera makes it easy to search for that. We don't need a PPO network with Sedera because I can go anywhere I want to go. When I'm a cash pay patient, everybody takes cash. So, and then Sedera is a health sharing community that is agnostic. There's no statement of faith that you have to make, although I think that that's a wonderful thing. The commitments that we make to the rest of our community members are just a commitment to a healthy lifestyle. We're going to go over that. Okay, let's just look at a quick graphic about how this sort of works in a visual setting. So these little hearts over here are Sedera members, and all Sedera members are contributing to a bank account at a certain amount, and then via direct deposit, if you have a need that needs to be shared, that's done electronically, and then it's direct deposited into your bank account when you have a need to share with the community. Okay, let's define a need. That's very important. Talk about how needs are submitted and some of the other intricacies about healthcare cost sharing. This continuum represents what a need is and how that's defined. So I mentioned we all share needs with the community on a per need basis. And when you become a member of the community, you would have picked an initial unshareable amount. Okay, so I'll say that as IUA probably for the rest of the webinar. But if I picked an IUA, an initial unshareable amount of say 500 or any of the other amounts, then I would just cover the first 500 with my dollars and then share the rest of the cost with the community. Let's take this example. This actually did happen to me. I broke my arm some years ago, broke my arm. Now, I didn't go in an ambulance, but I did end up at the hospital The x-ray showed that my arm was broken in 10 places. And so I went through the surgery and the physical therapy. And so that whole continuum there is one need. And so for me, that broken arm lasted about 3 months, in its ordeal. So this is different than how insurance claims are filed against a policy. So those are insurance terms that I don't ever use when I'm talking about medical cost sharing. But if I had been a member of the Sedera community at that time, this entire ordeal would have been one need. And then the need is not resolved unless you're 12 months symptom or treatment free from that need. So one thing you should know is that Sedera does protect you from having unlimited exposure. So if your family unit or you as an individual have more than 3 needs in a year, then if you presented that 4th need to the community, you would not have to meet your initial unshareable amount. So there is a cap on your own exposure, but you are given unlimited access to the community to share needs with if that's what you need. So this is, a great way to cover actual catastrophic care without, having to have the very burdensome high insurance premiums that we find on the marketplace today. I want to give you one more perspective on how a need is defined. So let's take something much more serious, a sickness like cancer. So I think my mom registered for my webinar. I think yes, she made it. Hi, Mom. I'll unmute you in just a second because I want your perspective on this. So my mom is a breast cancer survivor, but she's not finished with her ordeal. She still sees a provider on a periodic basis. She still takes a chemotherapy pill. And so her need is not resolved. And it began nearly 3 years ago. So I think it was in the fall of 2018. She can correct me on this in just a second. I'm going to unmute her and get her opinion on something. But at the beginning of her ordeal, if she had been a Sedera member, she would have just simply paid her initial unshareable amount, whichever one in this list here that she would have chosen. And then that would be it. The rest of her costs would be shared with the Sedera community, even though it's been around 3 years in its, in its history. So what I want to ask you is, what do you think you've paid in out-of-pocket costs over the last three or so years? And correct me, has it been 3 years? Has it been longer? I don't remember.
Hello.
Hi, Mom.
Hey.
So, I want everybody to know we didn't plan this.
Yeah.
I just texted her about 5 minutes ago and said, hey, will you be glad to unmute and answer a question for me? So this is not staged, I promise. So, Mom.
Yes.
Has it been about 3 years since you were diagnosed with breast cancer?
I was diagnosed in October of 2018.
Okay. So I was approximately right. And here we
Right.
are, summer of 2021. What would you say would be your out-of-pocket costs over the last 3 years, approximately, that you think you've incurred on your Aetna plan that you're on through your employer?
I would guesstimate, Christy, conservatively $7,500.
Okay. Not bad. She works for Costco, a great employer. But under an insurance plan, her deductible resets every year. Okay, I'm going to go ahead. I'm going to go ahead and tell you to mute yourself again, and I'm going to move on from this slide. Okay, thanks, Mom.
Okay.
I want you to understand that having an insurance-based plan with a deductible that resets every year is nowhere near as smart as having, an initial unshareable amount with health share like Sedera. Now, I've been a member of the Sedera community for almost exactly 1 year. It'll be Monday. That'll be my 1 year anniversary with the Sedera community. I haven't had a significant need to share, but last fall when I got my flu shot for me and my boys, I thought, well, I don't really need to share this with the community, but I do want to test the process. I want to see how this works in real life so I can tell other people how easy it was. And it was indeed this easy. I just scanned a copy of the receipt for the flu shot that I paid cash for. And by the way, I called around to a few pharmacies, and it just so happened Costco had flu shots for $19.99. And that was the best price that I found. And so while I was visiting my parents, me and my boys got our flu shots. So when I came back home, I just scanned the receipts, uploaded them to my member portal exactly as you're seeing it here. I did mine on a computer, but you can totally do this on a phone. And 2 weeks later, I had a check for $19.99 times 3. So for the total cost of the need, and the total cost was shared because it was considered preventive. I've got a slide in a few slides on what's preventive and what's not. So we'll get to that. But let's talk about another real life example. So for example, this family was on a $5,000 deductible on an insurance plan, and one of their children had frequent ear infections and ended up having tubes, surgically put into their ears. So I want you to see how that plays out with having health insurance and how it plays out with Sedera. Let's talk about how this looked with insurance. So first of all, they paid their copay and they bought some antibiotics, and that cost $60. And then they went in for another appointment, another ear infection, and this keeps happening over and over. So finally, the doctor says, I think it's time for you to consult a specialist and have tubes, put in the child's ears. So that was another $2,100. And remember, the prior slide said that this family had a $5,000 deductible. So this whole ordeal with the tubes being put in didn't even meet their deductible. And at this point, I really want you to know that actuaries at insurance companies geniusly figure out how, between the premiums that you pay and the deductible that you've agreed to, how they really don't have to take any risk whatsoever. So at that point, you really do have to ask yourself, why do we have insurance? What good is it at this point? So in medical cost sharing with direct primary care, and I haven't mentioned that word yet, but I'm going to talk about it a lot more. Many of you already know what direct primary care is, but for those of you who don't, these are the kinds of practices, primary care practices. Many of the doctors are family physicians, internal medicine, general practitioners maybe, but they've hung a shingle and opened their doors, and they've said, I'm not taking insurance, I'm just taking patients. I just want to help and heal my community by being available to my members 24/7. So in direct primary care, the cost of office visits are just included in your membership. And many have an inventory of commonly used drugs like an antibiotic that they can dispense right in-house and just pass through the cost to you. And you can use pre-tax dollars usually to pay that if you have, like an old HSA that has some money still left in it, or just, if your employer is funding an HRA that you can tap into, you can still pay for those out-of-pocket costs. I mean, it might be for an antibiotic dispensed in a DPC practice might be, a few bucks, nothing big. But all these office visits would just be part of your direct primary care membership. And for those of you who don't know, the average national cost for a direct primary care membership is around $75 a month for an individual. My direct primary care doctor charges me $65. I'm in rural North Carolina. So based on your geography, that's about the national average. But I'll show you a place where you can go find DPC doctors in your area. So with direct primary care, all these office visits are included in your membership. And then let's say you do need to be referred to a specialist in order to schedule this surgery. Let's say the specialist costs $250. You just pay that with cash. And then you move on to this surgery. Well, Sedera will waive your initial unshareable amount if the surgery is done at one of the direct care surgery centers. And there's some on the map, and there's more popping up all the time. So look at how this is different from insurance, especially if you have a direct primary care doctor who takes care of you 24/7, like having your personal physician on speed dial. So if you don't have direct primary care in your area, and you decide to just pay cash to any otherwise situated primary care practice. So let's say the cash price at primary care is $100 and you just pay that with cash. Then by the time you got to the point where you needed a big surgery like that shared, you may have already met your initial unshareable amount. So that's what this represents. Okay, I have a question in the question box. Do you ever get pushback from employers or other brokers when bringing up HSAs for DPC costs? So the real technicality on that is if you have an HSA that you used to contribute to when you had a qualified high deductible health plan to tie that to, the money that's on deposit in that HSA is still able to be used for what's called accepted benefits or any of those expenses that you can find listed in Section 213D of the IRS code. You can also find that easier by going to irs.gov and searching publication 502. So all of the things that you can find in that publication are, what you might consider out-of-pocket costs. So if you've got money left over in an HSA plan that you, maybe you're not contributing to it now because you don't have a high deductible health plan, or maybe you are, it doesn't matter. If your direct primary care doctor passes through a cost, like for instance, with my DPC membership, I get a full, very complete lab workup once a year. And then if he wants to check my A1C every 90 days, then I just pay a little bit extra. I think it's $8 for LabCorp to check my A1C periodically throughout the year. So a nice, big, full workup is included in my membership. But if I had an old HSA with money left over in it, or if I was already on a high deductible health plan with an HSA that I still contribute to, I can still use my HSA money for instance, that $8 to check my A1C. Well, I think the ultimate question that you're asking, Nathan, is about how employers need to know how to juggle all of this information. And you're right. The gray area is that right now, or at the end of the Trump administration, there was some talk that HSAs might be unbundled from high deductible health plans and allowed to stand alone. We're not seeing any movement at all on that right now. And the way the IRS views direct primary care is as if it were its own separate health plan, which makes new contributions to an HSA on a high deductible health plan ineligible. So personally, I'm just going to give you my personal opinion. I would much rather be in a situation where I didn't have a high deductible, I didn't have to pay copays, I had my personal physician on speed dial, and I had a way to share the costs of catastrophic care with a community of people that I'm in membership with. And I would rather take that extra money that I was paying in insurance premiums and put it in a retirement plan. Because a lot of people have called an HSA like a healthcare 401k, but it never actually works out to be all that valuable, because that never changes the starting price of the care. It's always way up here. And, you know, when you've got extra money laying around, I would rather contribute it to a retirement plan or a stock option that you might have. So that's my personal opinion. As far as how we're watching the movement in Washington to see how DPC and HSAs play together in the sandbox. But for right now, Nathan, you're right. It's gray, but I would just say you're still allowed to use HSA money for incidentals, just not the monthly membership. So, and then you can't make new contributions once your employer starts to pay for the total cost of your DPC memberships. Other ways around that, we're getting way into the weeds. We should probably have a conversation offline, but that's kind of my opinion on that right now. So, and then one more question. Yes, we're going to talk about pre-existing conditions. Definitely. That is actually the next slide. So thank you for teeing that up. Okay. Pre-existing conditions. So since Sedera is not insurance, it is able to protect the community a little more than insurance companies are allowed to now post Affordable Care Act rules. So, for the first year, there's no sharing for a pre-existing condition, and they look back 3 years. So anything that you've been diagnosed for, treated for, seen a medical professional about, or take medication for is considered pre-existing from the last 3 years. So no sharing for that condition in the first year, but then they phase that stuff in over the next 2 years, so that at year 4, all of your healthcare needs are fully shareable. Now, I want to expand on this and tell you, I myself entered the Sedera community as a person with a pre-existing condition. So I have type 2 diabetes. If I unmuted my mom, she would tell you that it just runs in our genes. And I have a thyroid that doesn't like to cooperate with me, and I have high cholesterol. So in my defense, the cholesterol thing, I had that when I was 18 and weighed 100 pounds. So I don't think I'm getting rid of the cholesterol issue in anytime soon. I think I just need to take a good medication to keep it under control and eat lots of vegetables. But the type 2 diabetes, you know, I need to work on that. So I kicked the tires on this Sedera thing for about a year longer than I wish I would have, looking back. So once I figured out that Blue Cross and Blue Shield of North Carolina that I used to be on through my husband's employer, they were making money off of me. Forget the fact that they'd like you to believe that if you have a chronic disease that you're like marked and branded, you know, and you're stuck in their insurance pool and you can't get out. I finally resolved to the fact that was malarkey, and I was being fed a lie. And I decided that between me and my direct primary care doctor, who sees me anytime I need him, even if it's late at night or early in the morning or whatever, or if we need to connect with each other just through text or video chat or whatever, if between me and my DPC doctor, we could totally handle the type 2 diabetes together. And we're making progress on it, chipping away at that challenge. And so now I told you my 1 year mark is Monday, June 21st. I've not needed to share anything with the community related to the type 2 diabetes, as I'm sure I never really had to share anything with the Blue Cross risk pool, when I, from the time I was 37, you know, to when I left that insurance plan, because I was diagnosed with type 2 diabetes when I was 37. I'm 47 now. So I just want to encourage you. Now, I cannot make your decision for you, and I don't want to influence you in a way that you're not comfortable with. But I just want to share my experience with you and just let you know, if it's a chronic disease, it's lifestyle related, and you could totally make progress on it if you had the access to very frequent care. I mean, daily, if that's what's needed, hourly, if that's what's needed. Direct primary care is a game changer for people with chronic disease who need just that extra support to really coach them into that self-care mode where you're really making progress and you're really able to better handle your chronic disease. So I'll encourage you that way and just say, I wish I hadn't waited the extra year. And now that I am a year into my my membership with Sedera, I'm very thankful that we're not spending the kind of insurance premiums that we were spending. And I'll go ahead and tell you, on my husband's health insurance, we were spending about $1,000 a month additional than what my husband's employer paid for him. We were paying about another $1,000 a month for the rest of us, me and our two boys. And when we made this move to Sedera, we immediately saved about $700 a month, which gave us the found money, to invest in a direct primary care membership. And then, we just went on from there. And trust me, life has been great. We've never had better healthcare than we have in the last year. Let's talk about medications. So monthly maintenance medications, sort of like what I take for my thyroid and those are not shareable unless you're a member already and you have a new prescription. They'll go ahead and share with you for 120 days while you kind of get your situation figured out. And then most monthly medications, monthly maintenance medications, are available in generic form for pennies on the dollar. And this is something I didn't even realize myself until I was actually paying cash for my monthly maintenance medications. So, and it's honestly one of the concerns I had leaving insurance and going over to Sedera, but it turns out it was a non-issue. So let's just take Lisinopril, very common generic drug, as one example. And I take it, and my oldest son takes it because he also has high blood pressure. He was diagnosed with that when he was 9 years old. He just needs to take a pill to keep it under control. So Lisinopril, it costs about a $4 cash price at Walmart. You can get it at Publix for free, I'm pretty sure. Or it's on one of their $2.50 lists per month. So if you have a Publix near you, ask them for their prescription free list and their $2.50 list. I think Lisinopril is on that. But when I was on insurance, I was paying about a $10 copay for that every month, which is totally not necessary because it doesn't cost that much. So when I went onto Sedera and I started talking to some direct primary care doctors who dispense medications in-house, they say, oh yeah, Lisinopril, that's about $1.80 for a 30-day supply. So again, I hope you're seeing the theme here. What good is insurance when the cash price is lower? Now, curative medications, however, are altogether a different story. Those are shareable. So curative medications are things that, as the name might imply, you take them once or over a temporary period of time, and then you're cured, and then you don't have to take them anymore. So like an antibiotic, like I mentioned before, or even chemotherapy. So they're curative, they're a temporary situation, but they are shareable with the Sedera community. I think that's important for you to know. Now, Sedera makes it very easy for you to shop and find out where in your community you can get your prescriptions at the lowest price. And so Sedera's RX Marketplace operates a lot like GoodRx, but it's way better than GoodRx. So if you've heard of GoodRx or tried it, one thing that you might have realized is that it only really works in the big box retail pharmacies. The huge players in our market is sort of leaves out the local independent pharmacies. The Sedera's RX Marketplace pulls in the big retail giants and the local independents. So you can actually find many times a lower price at a smaller local independent pharmacy than you can at the big box retailers. So there's 4 different ways that the RX Marketplace can serve you. And of course, GoodRx does none of this. Like it won't deliver drugs to your home. You can arrange a better, more like volume-based price. If you'll fill your prescription online and have it delivered to your house, you can get a little discount for that. International mail order is another thing that GoodRx won't do that Sedera's RX Marketplace does do. And I take advantage of this myself. I buy insulin from a Canadian pharmacy, and it costs me about 1/5 of what it would cost here in the United States. And then lastly, if you need a really expensive drug, something that would be truly unaffordable, if you qualify for one of the patient assistance programs, Sedera's advocates will help you kind of get that started. And that way the manufacturer pays for your drugs and ships them to your home. So just a few ways that Sedera members get a leg up on healthcare costs. Okay, let's talk a little bit more about direct primary care. So I mentioned that a good amount when we were talking about that real life scenario. So in people that have a direct primary care relationship get a 14.5% discount on their Sedera membership. And then you can also see that Sedera keeps a map, and you can find this on Sedera's public website. It's constantly being updated. Also, they think that if you can't find a direct primary care doctor in your town, but you'd be happy with virtual primary care where there's no brick and mortar, but there's your personal physician on speed dial that you can access virtually all the time. That they honor that too. And then I mentioned a second ago that we also love free market surgery centers. So, like for instance, if you're looking at the map, you see this little blue dot in Oklahoma. That is the Surgery Center of Oklahoma. Incidentally, I host a podcast called Healthcare Solutions. Please look it up if you would like to, hear me go on and on about healthcare on a podcast. But today was released my newest episode, and I did interview Dr. Keith Smith of the Surgery Center of Oklahoma, which was one of the, I believe it was the first ambulatory surgical center to post their cash prices online so the whole world could see. So Sedera loves this idea so much that if you'll choose one of these free market surgery centers, and more of them are popping up all over the country and are going to start to be added to this map frequently, then you could possibly get your initial unshareable amount waived. So direct care, I'm a big fan. And so is Sedera. Okay, let's talk about preventive care. So a colonoscopy after the age of 50, a mammogram after the age of 40, the childhood immunizations, flu shots, and mental health up to $750 after you meet your IUA. That's all considered preventive care. And so these first 4, the colonoscopy, mammogram, immunizations, and flu shots, those are available, fully shareable, 100% without having to meet your IUA. The mental health comes in after you meet your IUA. Anyway, these preventive tests are very important. So, my mom is after me to get my mammogram. Sorry, Mom, I haven't had one in 2 years. But when after July 1st, I've got my appointment already at a freestanding, independent imaging center in Asheville, close to where I live. And so I don't need an order from a doctor since it's been more than 2 years. And I need a 3D mammogram. So I called Sedera and I asked them how does it work if I need a 3D mammogram? And they said, absolutely. If that's what you need, that's shareable every other year. So good news on that for me. And my mom can rest easy. I'm going to get my mammogram soon after July. Okay, member beliefs, member commitments, member services, some of the best people on earth, and then contribution rates. So as Sedera members, we're not required to make a statement of faith, and that's okay. But we agree not to use illegal narcotics. We agree not to operate a vehicle while intoxicated. And if we use tobacco, we pay an extra $75 a month. In addition, in the fine print down there, you'll see that tobacco users, which includes vaping, over the age of 50, your shareable amount is limited to $25,000 for the 4 disease states that are most closely related to tobacco use. So that's cancer, respiratory disease, vascular disease, stroke, and oral or esophageal disease, gastric and duodenal ulcers. Okay, so it mentions also C-section 8 in the Sedera guidelines. So that's something that you're going to find on Sedera's website. And if you don't find it, I can send them to you. The guidelines are about a 49-page booklet. And it really is like your user's manual as a Sedera member. So I read it cover to cover when I became a Sedera member, and it addresses everything. And I never disagreed with anything the way that it was stated how things would be shared. The folks at Member Services are truly some of the best folks on the planet. I email them frequently with questions that either I have for myself or questions that people that I'm helping have questions about, and they're very responsive, always friendly and ready to help and dig into the details as much as anybody would want to dig in. So when it comes to just navigating the complex world of healthcare and how medical cost sharing makes that easier, that you can depend on them for that, finding the cash pay friendly providers, and then interpreting and helping you understand the medical cost sharing guidelines. And then second opinions, that's something that you're definitely going to want to tap into if you need a surgery. So that's built into your membership. Here's the slide on GoMD. Second MD. This is your second opinion service. And if you'll do that, it is required. If you'll do it for any elective surgeries, then they'll knock off $250 off of your IUA. You don't need Teladoc if you have a direct primary care doctor, but if there's not one in your area and you don't want to sign up for virtual primary care, then a Teladoc membership is built into your Sedera membership. And so that's a way to access a doctor 24 hours a day. These rates are for employers who want to offer a Sedera membership to their employees as an option or their entire healthcare benefit. I joined Sedera as an individual, so those rates are just a tick higher than these, not much at all. But you can see, let's just look at these a little closer. So above the gray line is if you're under 30 years old, if you choose the 500 IUA or the 1,000 or so on and so forth, you can see employee only, employee spouse, employee children, employee family. These are all together a fraction of the cost of health insurance, even if it's on the marketplace. And even if you're on the marketplace and you're getting a subsidy, most of the time, the deductibles are so high on those marketplace plans, it makes them prohibitive to use. So Sedera is actually a health care option you can actually use and not go bankrupt. Okay, and then under the gray line is if you're over 30 years old. So these are the rates that would be, there are transparent rates. They're published on Sedera's website. They don't change based on health conditions or whatever. And this is what employers would extend to their employees. And if the employer wants to pay part or all of these fees for their employees who like Sedera, they're more than willing to do that, but it's not required. Since it's not insurance, employers don't have to cover these costs, but it's certainly a goodwill measure as an employee benefit if they would. Okay, here's a little brag sheet on Sedera. They're just a great company all around. Here's how you can get in touch with me. I am president of Custom Benefit Solutions. There's my phone number and my email address. If you like the concept and you're ready to join, go to sedera.com/join/custom benefits. And that's the link where you can still have me as your advocate and someone to talk to and ask questions to and just partner up with you in general to get the best use out of a Sedera membership. I'm going to do this again on July 2nd. So if you're an individual and you want to hear this again, or you want your spouse to hear it, or if you're a DPC doctor and you want some of your patients to hear it, or if you're an employer and you want some of your employees to hear it, join me again. We're going to do this all over again in July. Okay, somebody asked me a question in the chat. Let's see who that is. Oh, thank you very much, Dr. Wallen. Okay, one more thing. I want you to know that Sedera is part of the transparent healthcare movement. We can't really get that from insurance companies. And I want you to know about a grassroots organization that is advocating for transparency, and especially in hospital and healthcare pricing. So watch this video real quick. It's very short. And then I'll say a few more words about that later.
I'm Shepard Ferry, and I'm an artist and an activist. I'm participating in the Power to the Patients movement because I'm a type 1 diabetic. My wife has multiple sclerosis, and I've seen the devastation that the high cost of medical bills can create in people's lives. When people need care, they're not provided with the prices of that care up front. This can either leave people with tremendous bills or be a deterrent to them getting the care that they need. There are laws on the books that mean that prices are now a patient's right. But providers continue to get away with a lack of transparency, pricing that is not consistent. We have the right to know how much our healthcare costs up front. It's our health, it's our money. Power to the patients. For more information about this campaign, go to powertothepatients.org.
Well, I hope you got as much out of that as I did. If you're interested in becoming a member of Sedera or learning more about how transparent healthcare is priced and how you can access better care through a direct primary care doctor, plus a wraparound catastrophic plan like Sedera in a membership model, I'd love to talk to you. I hope you all have a blessed day. I'm going to check the questions one more time before we say goodbye. But thank you, and please spread the word if you want to attend next month's webinar or help other people learn about it. Just send me an email and I will send the registration link to you. Thanks again, everyone.